Sometimes we can also see there is a central clearing. Central clearing means you can see the red color of the lesion. That means there is an inflammatory reaction. Sometimes we can see that in the central region that red coloration or the raised edges are not present. These all indicate of the high cell mediated immunity that are present. However, when further examining the lesion, if we try to look for the neural manifestations, that is the sensations, initially there will loss of temperature sensation followed by pain and finally tactile sensation. I am not delving into the details. I think you have already read in your physiology the type of the neural sensation. So this is the gradual progression of the loss of nerves. However, just one exception you should remember, on the face the sensory impairment is very difficult to demonstrate, not because of the nerves but because of the surrounding nerves that involve the area. Whereas on the limbs the dermatological manifestations are more common. If you want to understand these features, uh, you can look at the dermatological map of the human body. In your anatomy classes, I think you have already read about the dermatological mapping. So, in the hands and the limbs, you will see that a single nerve will be providing sensation to the large part of the skin on the limbs. Hence, if those nerves are damaged or affected, these neural manifestations will be more predominant. However, if you look in the facial region, there are multiple nerves involved. Hence, if the lesion is present on the face, sometimes the neural manifestation may not be elicited totally. Now, what could be the differential diagnosis of this kind of lesion? It could be very commonly seen what is known as the tinea or ringworm infection. It's a fungal infection, and a very characteristic feature of the fungal infection is called as central clearing. Well, you will see a raised or an inflammatory ring of reaction along the lesion with central clearing. That is very commonly seen with a tinea. Other would be subacute lupus erythematus. It's a varied presentation of SLE. I think you have heard about SLE. No, fine. Other would be the annuloid sarcoid or syphilis. So these are the differential diagnoses. If you don't get right now, it's totally fine. You will read about all the disease later on. Now, after the tuberculoid type, we need to understand then what is the borderline type. Among the borderline type, this is the most common type of leprosy that is seen. Now, if we look at this scale, the borderline is, why it is called borderline? এদিকে বাচ্চা ওদিকে কমছে, that is fine. The borderline কেন বলছে? Because it may progress to any scale of the disease. Suppose if we are treating a patient who is having borderline type of manifestation, what will happen? The patient's immunity will start to increase as the bacterial load decreases and the manifestation will move towards the tuberculoid type. And if we do not treat the patient, what will happen? The bacillary load will increase and along with that the cell mediated immunity will decrease and the manifestation will move more towards the lepromatous type of leprosy. Now, these are the skin lesions which can be seen with borderline leprosy. Now, these skin lesions may vary in numbers and presentation and morphology based on the cell mediated type of immunity. Now, again, if we look among the borderline, we have borderline tuberculoid and borderline lepromatous. So, the presentation will be between these. Sometimes we can find the presentation that is of more of a tuberculoid type. Tuberculoid type means the lesions will be like this one. However, the number of lesions will be pretty high. very high so that we cannot even classify in them tuberculoid type. And sometimes the lesion may also be like that of lepromatous type, like you can see in the face of this woman. There is no definite outline, although raised erythematous large lesions can be seen. Another important feature would be the lesions of the skin will be fewer in case of borderline lepromatous type, asymmetrical, better defined, dry, shiny and smooth with absence of appendages. Why dry? Because there will be absence of sweat glands and sebum producing glands of the skin. That is the reason why the skin will lose the normal texture. These will come more commonly in the borderline type of. This is the type of lesion you can see in. Now we are still in borderline leprosy. The manifestation might be like of tuberculoid type. If that happens, we call it as borderline tuberculoid, or it may be like that of lepromatous type. Then we call it as borderline lepromatous type. So this is a type of lesion that we can see in borderline tuberculoid type. But this is not that of the tubercular type of leprosy. Why? If you see the lesion is circumscribed, erythematous, well marked. However, there are small lesions along the large lesion. These are called as the satellite lesions, finger-like projections, also known as pseudopodia. Not the pseudopodia of the amoeba, but of the lesion. That means this lesion is progressive. Hence, if you see this kind of lesion, this will be the type of presentation of borderline tuberculosis. Other manifestations could be like this one. Over here you can see a well circumscribed lesion, and even this one. Now look at this picture. This skin appears very dry and sometimes shiny because of the loss of appendages. And over here you can see the lesion with central clearing. Can you appreciate the central clearing over here? So this is the type of the tubercular type of lesion. Another very important part of here is involvement of large nerves. Now this involvement can be manifested by swelling along the nerves. The most commonly involved nerve is the ulnar nerve. So in tubercular type of leprosy, neural manifestation can be elicited how? When we start examining the ulnar nerve. When we try to palpate the ulnar nerve against the ulnar, the patient may not feel the nerve. What will happen if I try to examine your nerve? It will be very painful, right? But patients with leprosy will not be able to feel the pain. The second manifestation would be the nerve will be very hard or rod like structure. Normally, we cannot feel the nerves, it's a very soft and pliable structure. Only when we are trying to palpate the nerve, you will find a sensation. Then we realize that, oh, now we have palpated the ulnar nerve. But over in this patient, what will happen? If you try to palpate the ulnar nerve, you can feel a rod like structure. And over and above that, the patient will feel no pain. Next manifestation would be alteration of the action of the ulnar nerve. What is the action of ulnar nerve? It will supply the muscles in the ulnar, that is the median part of the forearm and fingers. That will be altered. But if the disease progresses further into the borderline type of leprosy, we can find swelling of the ulnar nerve. Keep in mind, this is not a localized swelling of the soft tissue. This is the swelling of the nerves itself, especially the perineural area. And sometimes even abscess may be formed. And obviously, if this kind of manifestation is there, you will have neural involvement. Okay. Now, coming to the borderline type of manifestation, these are the manifestations where you can see now over here the demarcation becomes more and more loose with very small types of lesions along with the large types of lesions. Or it may progress further where you can see almost erythematous patches and demarcation is almost gone. No longer these are raised lesions. These kind of lesions can be seen in the borderline type of leprosy. Sometimes in borderline cases you can observe both kind of lesions in the same patient. Now look at this presentation. This is the type of presentation you will see in borderline lepromatous. I think you can perceive what I am trying to do. I am trying to show you the pictures from tuberculoid type to lepromatous type. Now look over here. No longer we can demarcate the areas of the lesion. Almost diffuse lesions can be seen. Furthermore, these lesions now are multiple and very small, also called as macules. They are very small in size and distributed over a large surface area. And along with all other types, like all manifestation of skin will be there. That is loss of skin hair, sweat glands, and sensation. When it regresses further, we can also see this kind of nodular reaction. This is also called as type 1 reaction. Today I am not going into the types of the hypersensitivity reaction because it will be too much for you. These kind of reactions can also be present. Now for the last type, that is the lepromatous type of leprosy, where the cell-mediated immunity is at its lowest point. Here the skin manifestation would be like this. Now you cannot appreciate the skin lesions itself. Rather, the whole face appears altered. What are the features that you can see over here? There is swelling of the eyebrow, change in the texture of the skin itself, loss of the eyebrow, hair loss will be there, and prominently eyebrow hairs are lost. Look over here, there is erythematous lesions and wrinkling of the skin, hard indurated skin of the ears. In this picture, can you see there is complete loss of eyebrows and also eyelashes? And over in this picture, can you see there is something wrong with the nose? What is there is depression of the nose. This depression occurs because of the nasal cartilage that gets eroded. So the bridge of the nose gets depressed. And sometimes in severe cases, especially after treatment, we can find this kind of lesions. This is also called as ichthyosis. Remember, ichthyosis like manifestation. Ichthyosis is a different disease. After treatment, this kind of manifestation may also be seen. Okay, so having shown you all the stages of the disease, now let us recapitulate what goes on with the full disease manifestation. Now, what is infection? When a person acquires the organism. So, what can happen? At the initial stage, the body can eliminate the organism itself. If this happens, well, obviously there will be no disease. The second stage would be the infection. After the infection, the body starts reacting against the organism, and there starts the constant battle between the pathogen and the human body. Thereafter, the human body will start to respond to the organism, and the response will be based on either adaptive response or innate immune response. The innate immune response will defend the patient from other infections, and among the adaptive response by the cell mediated, it may come into early or subclinical infection, which may be totally asymptomatic or be manifested like the indeterminate type, or it may progress to leprosy disease proper, which we can classify between the tuberculoid or the lepromatous type. So this is overall presentation in a nutshell. Now, having understood that, another important aspect of diagnosis is this diagnosis was clinical diagnosis. Now we need confirmation of the diagnosis. That confirmation can be done by three methods. The first method is what you already know is called as acid fast staining. We look for the acid fast bacilli. Obviously, because it's a mycobacteria, so we can use acid fast staining. The second method is called as fight Faraco staining. This is a modification where the acid fast bacilli is seen much better. Hence, it is also a recommended method of diagnosis. And the final part is using fluorescent microscopy. By this method, we can directly demonstrate the pathogen from the lesions of the skin or the nerves. Now, how to demonstrate? That is how to collect the sample. That method is called as preparation of split skin smear. Now, what is split skin smear? We are not cutting the skin. Where would the pathogen be if it tries to remain in the dermis and subdermis? So we need to split the skin so that we can extract the bacilli. We don't need to cut the skin throughout. Understood? Now, from where we should take the samples or the split skin preparations? Obviously from the lesions, and along the other side like ear lobules or sometimes elbows or knees, and also around the nerves which are thickened. I have already told you, thickening of nerves means there is inflammation going on in the perineal region. So if the nerves are thickened or swelled, that means there is inflammation going on. If the inflammation is going on, the possibility of the pathogen being present is higher. Okay. And also normal looking but suspected sites. That means a patient may have a presentation of suggestive of leprosy on a part of the body, whereas on another part of the body you might feel that this is another type of presentation, may not be suggestive of leprosy, but you can still take the smear. Now, how to do it? First, you have to prepare the skin by rubbing the skin with alcohol. Then you need to take a blade, scalpel blade. Then what you have to do is you have to push the skin like this, not press, push. When you start pushing the skin like this, what happens is that there is capillary vasoconstriction. So when you press, then we have to press the blade on the skin like this. We don't need to cut it, just press the edge of the blade on the skin. So when we are pressing the edge of the blade on the skin, what happens is the upper layers of the skin are split, not cut. And when that is split, only we can find very small amount of capillary bleeding. Then with the tip of the blade, we need to scrape the two sides of the split skin. This scraping is the sample. After that, we need to take the scraping and put it on a glass slide over a small area. Why? Because if you spread it over a large area, the probability of getting the diagnosis correct will go very low. On a small area, we need to put that smear and then heat fix it and then stain with acid fast staining. Now, this is the chart that I have compiled so that you can remember the differences between the acid fast staining of Mycobacterium tuberculosis and Mycobacterium leprosum. You are already acquainted with acid fast staining of Mycobacterium tuberculosis. Now let us look at the differences. The first difference is that for tuberculosis the method is Ziel-Nielsen staining. For leprosy we can use Ziel-Nielsen staining. However, Fight Farrakhan staining is preferred. In both this we have carbon friction as the primary stain. However, in acid fast staining for Mycobacterium tuberculosis, we were heating the carbon exactly because of the thicker cell wall of the Mycobacterium tuberculosis, especially with the presence of higher concentration of mycolic acid. Hence, we have to heat the slide after putting carbon friction. But for Mycobacterium leprae, we do not need to heat. That is the first difference. Now comes the second difference over here is the decolorizing agent. In case of Mycobacterium tuberculosis, we are using either 3% acid alcohol or we are using 25% sulfuric acid. For Mycobacterium leprae, we are using either 1% acid alcohol or 5% sulfuric. Okay, that means the strength of the acid is lower in case of Mycobacterium leprae. What will happen if you use 25% acid for staining Mycobacterium leprae? What will happen? তাতে কি হবে? It will decolorize the bacteria. It will no longer be acid fast. So this percentage is the highest percentage of the acid which the bacilli can resist. If you use 6% acid, then also it will no longer be acid fast. Have you understood this or not? কোনো response নেই? What will happen if we use 5% acid to stain Mycobacterium tuberculosis? Will it be acid fast or not? বোঝা গেছে না বোঝা যায়নি? Mycobacterium tuberculosis জন্য কত পার্সেন্ট অ্যাসিড ইউজ করা হয়? 20 বা 25% যে বইয়ে যেমন আছে সেটা বলবে। আমি যদি 30% অ্যাসিড ইউজ করি কি হবে? ডিকালারাইজ হয়ে যাবে। যদি 10% অ্যাসিড ইউজ করি তাহলে কি হবে? তাহলে অ্যাসিড ফাস্ট থাকবে। দ্যাট মিন্স ডিকালারাইজ হবে না। কিন্তু Mycobacterium leprae ক্ষেত্রে কি হবে? আমি যদি 10% অ্যাসিড ইউজ করি decolorize হয়ে যাবে। It will no longer be acid fast. If I use 30% acid, it will no longer be acid fast. It will remain acid fast till we are using 5% acid. And in case of Mycobacterium tuberculosis, it will remain acid fast till it is 25% acid. মনে থাকবে? So this is the important difference. Another important feature is that in case of Mycobacterium leprae, commonly we can see the bacilli in clumps which are also called as globi. This is the picture where you can see red color bacilli or acid fast bacilli singly and also in clumps. These clumps are also called as globi and sometimes it is also called as cigar shape. Why cigar? Because earlier the packs of cigar used to come in a pack where the cigars are placed in a round container. Now you can try to imagine this is like an open container of cigar. But commonly termed used is the formation of globi. And if the number of bacilli is very high, you can see huge number of bacilli in clumps. This is how it is seen under the microscope. Now one more important aspect is, after observing these bacilli under microscope, we also need to grade them according to two index. The first index is called as bacteriological index, in which we grade according to the number of bacilli that are seen per oil immersion field. That is called as bacteriological index. Another index is called as morphological index. Now what is morphological index? Can. What is the importance of morphological index? And why does a living bacteria is uniformly stained? আর একটা important জিনিস কি? You are trying to treat the patient. Whether the treatment is effective or not. So when the bacteria is a viable, when we are staining, what determines the staining of the bacteria? It's the cell wall structure. So a living or a viable bacteria will have an intact cell wall. If the bacteria is dead or fragmented, that means the staining will not be proper. So on this smear examination, we have to look for the bacilli which are uniformly stained, and also count the bacilli which are non-uniformly stained, also called as fragmented bacilli. For example, if a bacilli is like this and it is uniformly stained, we call it as fully stained or uniformly stained bacteria. Sometimes you can also find a bacteria which is broken or a bacteria which is not stained totally. These are called as fragmented bacilli. Now what will be the morphological index? We need to count a total of 200 bacilli, and we need to count the number of uniformly stained bacilli. Suppose after counting you have uniformly stained bacilli as x, so morphological index will be x by 200 into 100. So this will be your morphological index. What is the practical application of morphological index? It can determine whether the patient's condition is deteriorating, progressing based on the treatment or the presentation. Understood? Okay. So this is the bacteriological index, where the grading is done initially. You can see the grading from 0 to 6 based on the number of bacilli per oil immersion field. This is the morphological index. If the morphological index is more than 5%, that means it's an active disease. If the morphological index is less than 1, we can say it's a non-viable bacilli. That means the treatment is effective or the patient will not deteriorate. And if the morphological index is 0, that means the treatment is completed and it is expected the patient's infection is cured. Why this is important? Because all the manifestations that we have seen is because of the reaction to the bacilli. Even after treating or completely curing the patient, some of the lesions will still remain. And if there is neural damage or deformity, you can cure the patient of the disease, but you cannot cure the deformity. For that you need to send the patient for rehabilitation, either physical rehabilitation or surgical rehabilitation. But prior to doing rehabilitation, you need to confirm whether the patient is cured or not. That can be determined by the morphological index. Understood? Another important aspect is if the morphological index is high, there is a chance of what is called as ENL or Erythema Nodosum Leprosum. What is this? This is the kind of skin manifestation that is seen especially with patients who are started on treatment. Why this happens? Because now look over here. Suppose a patient is at borderline. What will be the immune status of this patient? Almost suppressed. Now you start the patient on treatment. The bacterial load will go down. Patient's immune status will start improving. And as the immune status of the patient starts to improve, that immune system is exposed to a huge amount of antigen for the lepra bacilli, because those bacilli are killed by the antibiotics that we are giving for treatment. Till now, his body was not able to mount any kind of immune reaction because the immune system was depressed. Now when we have started treatment, the body will start mounting an immune response. This immune response is manifested by cutaneous manifestation, especially the regions where skin lesions were already present. We can see eruption of new nodules, which will be red in color and highly painful. This is because of the enhanced immune reaction against the bacilli. এটা বোঝা গেছে না বোঝা যায় না? আরেকবার বলবো। সাপোজ তোমার পেশেন্ট বর্ডারলাইন টাইপের আছে, ইমিউন স্ট্যাটাস ইজ সাপ্রেসড, ইট ডিটোরিয়েট করেনি বাট সাপ্রেসড। সাপ্রেসড স্টেটে হিজ বডি ক্যানট মাউন্ট অ্যান ইমিউন রেসপন্স। তারপরে তুমি পেশেন্টটাকে ট্রিটমেন্টে স্টার্ট করবে উইথ অ্যান্টিবায়োটিক্স। হোয়াট উইল হ্যাপেন? যত অ্যান্টিবায়োটিক্স দেবে নাম্বার অফ ব্যাসিলাই কমবে, পেশেন্টের ডিজিজ ম্যানিফেস্টেশনটা কমবে, ইমিউন সিস্টেমটা রিকভার করবে। যত ইমিউন সিস্টেমটা রিকভার করবে তার সঙ্গে কি হচ্ছে, তুমি অ্যান্টিবায়োটিক দিচ্ছ বলে প্রচুর ব্যাসিলাই মরে যাচ্ছে। যত ব্যাসিলাই মরে যাচ্ছে তার অ্যান্টিজেনগুলো তার বডিতেই আছে। তো এখন যেহেতু ইমিউন সিস্টেমটা রিকভার করেছে, ইমিউন সিস্টেমটা ওই অ্যান্টিজেনের এগেনস্টে এবার ইমিউন রেসপন্স স্টার্ট করবে। এবার এটা কি টাইপ অফ ইমিউন রেসপন্স হবে? হিউমারাল না সেল মিডিয়েটেড? অবভিয়াসলি সেল মিডিয়েটেড। এবার এই ইমিউন রেসপন্সটা কোথায় ম্যানিফেস্টেড হবে? প্রিডমিনেন্টলি যেখানে ব্যাসিলারি লোড বেশি। সেল মিডিয়েটেড মানে যেখানে ব্যাসিলারি থাকবে সেখানে গিয়ে এফেক্ট করবে। ম্যাক্সিমাম প্রেজেন্টেশন কোথায়? স্কিনে। তো যেখানে যেখানে অ্যাক্টিভ লিজনস আছে সেই লিজনসের চারিপাশে দেখবে নিউ লিজনস বেরোচ্ছে। এই নিউ লিজনস ইজ নট বিকজ অফ দ্য ব্যাকটেরিয়া বাট বিকজ অফ দ্য ইমিউন রেসপন্স যেটা স্কিনে হয়। এবং এই লিজনগুলো কীরকম? নোডিউলস, মানে ছোট্ট নোডের মতো হবে। সেগুলো নামটা দেখো না, এরিথ্রিমা নোডোসাম। এরিথ্রিমা মানে কি? রেড কালার। নোডোসাম মানে নোডস, রেড কালার নোডস উইচ উইল বি হাইলি পেনফুল। হাইলি পেনফুল কেন হবে? সেল মিডিয়েটেড ইমিউনিটি যখন রেসপন্ড করে তাহলে কি সাইটোকাইন দিয়ে রেসপন্ড করে, ন্যাচারাল কিলার সেলস এগুলো চলে আসবে, লোকাল টিস্যু ডিস্ট্রাকশন হবে। লোকাল টিস্যু ডিস্ট্রাকশন হলে পেনফুল হবে। দিস ইজ কল্ড অ্যাজ এরিথ্রিমা নোডোসাম লেপ্রোসাম। বোঝা গেছে? এবার মরফোলজিক্যাল ইন্ডেক্স যদি বেশি থাকে তাহলে তোমার এই রিয়াকশনটা হওয়ার চান্স বেশি। কেন? না, ভায়াবল ব্যাকটেরিয়ার সংখ্যা বেশি। যদি মরফোলজিক্যাল ইন্ডেক্স কম হয় তাহলে কি ভায়াবল ব্যাকটেরিয়া কম, তাহলে ইমিউন রেসপন্সটাও অতটা বেশি হবে না।